Hello everyone. So as we all know that the Neet PG counseling is going on, so I'll discuss about the pros and cons of internal medicine as a branch so that it will be easier for you to decide upon whether to take internal medicine or not. So first of all, I'll discuss about the pros of internal medicine. The first pro is the internal medicine doctor is the most knowledgeable person. उसको सारे diseases की knowledge होती है that how to treat it और वेयर टू सेंड द पेशेंट अगर वो ट्रीट नहीं कर सकता उसको तो लाइक इफ अ पेशेंट नीड सर्जरी ही और शी नोड्स कि दिस डिसीज इज क्योर्ड बाय सर्जरी ओनली एंड ही नोज वेयर टू सेंड द पेशेंट तो दैट्स व्हाई हम लोग जो भी फर्स्ट जनरेशन डॉक्टर्स होते हैं फैमिली में आवर फैमिली रियली वांट्स कि हम इंटरनल मेडिसिन लें सो दैट वी कैन हेल्प आवर एक्सटेंडेड फैमिली in treating their diseases or maybe advising them where to go to get it treated. Another thing is that it's a very satisfying branch. You will get immense satisfaction by saving a life. Suppose a patient comes in emergency with VT, and if you just gave him a defibrillation and he will come back to life, it will really give you enormous satisfaction. Another thing is it's a very relatable branch. आपने पूरा MBBS में maximum टाइम मेडिसिन ही पढ़ी है क्योंकि यू वी रेड पैथोलॉजी वी रेड फार्माकोलॉजी एंड वी रेड मेडिसिन इट्स ऑल अ स्पेक्ट्रम ऑफ मेडिसिन ओनली सो इट्स अ वेरी रिलेटेबल ब्रांच हमने मोस्टली ये सारी चीजें पढ़ी है सपोज यू विल टेक अ डर्मेटोलॉजी और रेडियोलॉजी तो ये आपने एमबीबीएस टाइम में नहीं पढ़ी है सो इट्स इट विल टेक टाइम फॉर यू टू गेट accustomed to these branches but medicine में since you are not know a lot of things about it you will get accustomed to it very easily. Another pros of medicine as a branch is that it doesn't have a long learning curve. Suppose you'll take obstetrics or gynecology or surgery, and suppose you learned a procedure like you learn doing cesarean section. So you will have to spend 3 4 years learning that procedure under the guidance of a senior, and then you will be able to do it independently. But in medicine as a branch, it's not a very long learning curve. You just have to treat patients. So if you know about the diseases and with an experience of 1 to 2 years, you can definitely treat the patients independently. And another, the pros of internal medicine is you don't need a very good infrastructure to treat patients. Suppose I want to start my own practice. So I really don't need a very big infrastructure. I just need a room with a stethoscope and it's done. Also, the internal medicine is the only branch which is not dependent on any other super specialty or any other branch. Suppose, like in surgery, they are dependent on anesthesiologist or they are dependent on radiologist. So we are not much dependent on other branches as well. So these are some of the pros of internal medicine. Another pro is that it's a very logical branch, and if you are into algorithms and making a diagnosis and treating patient, you will really love it. If you have seen the episodes of House MD, so you will see how interesting it is and how logical it is as a branch. Now, coming on to the cons of internal medicine, the only cons is since we are getting more and more DM seats and everyone is going to doing DM. So the charm of internal medicine is reducing if you haven't done DM. And also in metro cities, patients wants to go directly to a super specialist than to an internal medicine person. So your number of patients will cut down in the private setup. In the government setup, you will definitely treat a lot number of patients. Like in government setup, I have to treat CLD, CKD, MIs. But once I'll go to a private setup as an internal medicine person, the patients will not come to me for these diseases. They will directly go to a gastroenterologist or a nephrologist. It is an issue. Another thing is ki, the main aspects of internal medicine like emergency or ICU was taken by other branches. Like we have emergency medicine as a separate branch, so they take care of the emergencies, and these anesthesiologists take care of the ICUs. So they're taking up your work. So if you won't be able to do DM, then you will at a loss at some point of time. Another drawback of internal medicine is keep now if you are going for a DM and number of seats in DM are enormous, so you'll definitely get a seat. But repeating the same 3 years of your life with so much toxicity and so much work you have to do, that's again a issue. With again you have to do the thesis also. Another thing is there is a lot of working hours and you have to study a lot. So again, you have to work a lot, so you'll have less time for yourself, and then you have to study a lot. So these are some of the drawbacks. Another drawback it is not a very much procedural branch. So you'll not have any procedures or interventions to do. Otherwise, you have to go to for branches like DM cardiology to do interventions. Otherwise, it's a less intervention branch. And if someone has very interest in doing procedures or doing surgeries or doing interventions, then you will be at a drawback at internal medicine. But overall, it's a wonderful branch, and you will really love the experience of doing internal medicine if you have an interest in it. All the best.